It is a terrible topic, even due to its characteristics of poor knowledge and awareness of the severity of such events. Let's start with the definition of this syndrome, the shaken baby syndrome. It is one of the most severe forms of child abuse in newborns and babies. And its characteristic is its mechanism. So, shaking baby due to frustration because the baby is crying, and so it can cause severe brain damage and neurological deficits. It is typical of the first year of life, even 4 months in particular, predominance in males. And just to let you understand the epidemiology of such problem, it is the main cause of severe head trauma in the first months of life. In some nations, in some countries with difficult social aspects, it is probably more frequent and common, but it is an ubiquitous problem, and it happens everywhere in the world. And the clinical and social consequence of such situations is that the event, so the phenomenon, does not stop during the action of shaking the baby, but can also cause some severe consequences. What is the pathophysiological mechanism of this syndrome? It is characterized by shaking. It's not a trauma, but it is linked to the characteristics of shaking in the baby who has poor neck strength, and it creates an acceleration and deceleration, so that in some structures, in some bodies, injuries may be created. The weak points in particular are retina. So, for example, some retinal hemorrhagia or other areas that are hit could be blood vessels right outside the brain, and due to this acceleration and deceleration mechanism, blood vessels may be torn, so they can create blood collection inside the skull. And then my colleague later on can explain better the characteristics of such movement. And then this mechanism of acceleration and deceleration can create a shock, and so can create brain swelling and an edema. So then the characteristics could be the consequences could be the subdural hematoma, the shock of nerve cells, and retinal hemorrhagia. So by shaking baby to stop, the baby crying, it's a frustration action, and maybe in most of the cases it's not a voluntary action of harming the child, of harming the baby. So by taking it from the back and shaking the body of the baby, you have the head moving around, the baby's brain moves back and forth inside the skull. So there are mechanisms in the skull that can be translated into retinal hemorrhagia. This can tear blood vessels in the portion between skull and brain. It can also tear blood nerves, therefore causing bleeding and nerve damage. So these are the weak points, the areas that can be damaged by such mechanism, in particular in the encephalopathy context. It is linked to a vicious circle of hypoxia, ischemia, edema, apnea, the subdural hematoma. So all this increases the intra-brain pressure, and they can create this this so-called bad edema, because it creates the death of nerve cells, so it creates a permanent damage. So what are the diagnostic tools that we have? The anamnesis, first of all. So if there is a lack of trauma or traumatic history, if on the contrary the child or brother or sisters had a previous brain had a trauma, or if the anamnesis can help us in confirming or avoiding any suspicion. These are anamnesis risk factors that are linked usually to socioeconomic conditions, but pay attention, these situations can be present or not, because as the previous speaker said before, this child abuse situations do not always occur in socioeconomic conditions or poor socioeconomic conditions. As diagnostic tools, we have the neuroimaging, and then Francesco Toni will explain all the elements of neuroimaging that can help us. The neuroimaging is very important as a tool to investigate and to understand the situation. And then the other screenings are the total body or the fundus oculi. And I would like to conclude by explaining a case study.